Ellicott Chiropractic Care welcomes you to our community education series, sharing practical health tips for Eastern Plains families. Today we are talking about aging more gracefully with less pain. Getting older doesn't have to mean hurting more. Michelle and I are right there with you. We've got adult kids, grandkids, and we definitely notice we don't bounce back the way we did at 25. But we've also learned something important. Aging and constant pain are not the same thing. If you're over 40 and starting to feel a little stiffer getting out of the chair, if you've caught yourself saying, well, I guess I'm just getting older, or if you actually wake up feeling tighter than when you went to bed, we want you to know that slow increase in aches might not be just aging. It might be something we can actually fix. Ellicott to the Springs. Chores before sunrise. Long days on your feet. Out here, we don't exactly live sedentary lives. So when stiffness creeps in, it's easy to blame birthdays. More birthdays. More stiffness. But here's the real question. Is it aging? Or is it lost motion? In the next few minutes, I want to show you what's normal and what's actually preventable. We'll talk about what happens to joints and discs over time and why movement plays a bigger role than most people realize. And I'll explain how chiropractic fits into healthy aging. Aging is natural. Stiff joints, reduced flexibility, a little slower recovery. That happens. But here's what I see every week in the office. Pain often shows up when joints stop moving well. It's not just time passing. It's motion decreasing in the joints. Your spine is made of joints, and joints are designed to move. They need motion. They need circulation. They need stimulation. When a joint doesn't move fully, the surrounding muscles tighten up. Inflammation increases. And over time, wear speeds up. Where there is inflammation, there is achy tightness or pain. You've probably heard the phrase, use it or lose it. That applies to your spine too. Your spinal discs are like little shock absorbers between the bones. They act like sponges. But here's something most people don't know. They don't get direct blood flow. Instead, they get movement flow. As we age, discs naturally lose some water. That's normal. But movement slows that process. Walking, stretching, staying active. That pumping action helps keep them healthier longer. The body adapts to what you repeatedly do. Long tractor rides, long commutes, evenings in the recliner. When movement decreases, joints stiffen, muscles weaken, posture slowly changes, and a stiff spine starts to feel older than it really needs to. When one area stops moving well, the body compensates. If the low back stiffens, the upper back works harder. If the hips tighten, the knees and back take more strain. If the neck loses mobility, headaches can increase. A lot of what we call age-related pain is really compensation. Healthy aging doesn't mean perfect posture or zero wrinkles. It means maintain motion, good joint alignment, strong supportive muscles, staying mobile. You don't have to feel 25, but you also shouldn't feel fragile. Dr. Terry and Michelle take this seriously. They walk regularly. They stretch. They try to eat well. They drink plenty of water. They're remodeling the house, staying active, and consistency beats intensity. You don't need a gym membership. You just need regular motion. Chiropractic care supports that process. Chiropractic adjustments restore joint motion. They help the body communicate and coordinate better. They reduce those compensation patterns. We can't stop birthdays, but we can help your spine move the way it was designed to. Here's something simple you can do to reset your spine. Stand tall. Roll your shoulders back. Gently tuck your chin. Take one slow breath. Lightly extend through your low back. Try it right now. Your spine needs breaks, even during the day. Getting older doesn't mean accepting constant pain. If you're feeling stiffer each year, it might be time for a preventative spinal check. We can't stop birthdays, but we can help your spine age better. We're here for families across Ellicott, Simla, Yoder, Rush, and the surrounding Eastern Plains. If this was helpful, share it with someone who says it's just old age. And subscribe for more local health tips. We're grateful to serve this community. This has been another Ellicott Chiropractic Care community education video, helping Eastern Plains families stay healthy, strong, and moving.